Good morning. My job today is to introduce the topic and welcome you all after, of course, Vijay has welcomed you. I work for a marketing and branding agency, as Vijay mentioned. We're called Darden Lens. And Darden Lens specializes in companies that market to healthcare organizations, hospitals. And so I'm very familiar with the challenges that companies face marketing to hospitals. But preparing for this event, I got the chance to really focus on the subject and talk to a lot of people that are currently selling their products to hospitals and also people within hospitals. And so through that exercise, I got a chance to ask them one relatively simple question. And the simple question I asked was, what does a company do to prepare to market to a hospital? And the answer from absolutely everybody was, well, that's going to really depend. And you know, that is kind of scary if you're the person putting the program together. It depends is not exactly a question that you can stand up confidently and say, I can answer that question in these two events. What I can do, though, is present a program that has a lot of details about what it depends on. And that's really the purpose of this session and the next session that Vijay talked about is what are all those factors that you need to consider when you're planning to market and sell to a hospital. And so without further ado, I'm going to dig into the first topic, which is really just setting the landscape for hospitals. So what is a hospital? If you think about the definition of a hospital is an institution that provides medical and surgical treatment and nursing care to injured and sick people. That's like a huge definition. So the different kinds of hospitals, there's a whole lot of different kinds of hospitals. There's academic medical centers, there's community hospitals, there's private hospitals, pediatric hospitals, rehabilitation centers, all sorts of different kinds of hospitals. So why do you care? Well, we need to think about what makes all of these different kinds of institutions different. If we look at data for the hospital market, here's some data. You can't have a presentation without a pie chart, right? That's just not possible. So here's my pie charts. There's only two slides of pie charts. The first one being the hospital market in the US according to the American Hospital Association. There's about 5,600 hospitals in the United States. They break them down based on various factors, but one of the big ones is community hospitals. Community hospitals being the biggest bucket. About 5,000 of the hospitals are community hospitals. But you can break those down even further to about 58% of those hospitals are non-government, not-for-profit hospitals. About 20% of them are government hospitals. About another 20% of them are for-profit hospitals. You could also break those community hospitals down into ones that are rural versus urban hospitals. About 68% of them are urban, about 38% of them are rural. So we can look at data for this market, or we can look at the Ohio market specifically. The Ohio Department of Health has data for 234, I believe, is the number of hospitals. More than half of those are not-for-profit organizations. About 10% of them are church hospitals. Lots of different ways you can slice and dice the marketplace. But the point being is there's a lot of different ways you can look at and cut up and divide up all the different kinds of hospitals. So what are those axes of differentiation? What are all the different ways that a hospital is different? Well, the first one is probably size. That's maybe the most obvious one. One of the common measures of size of a hospital is the number of beds the hospital has. That may be a great way to measure and to classify a hospital for certain products. But with the trend towards more less invasive surgery, shorter hospital stays, less time, that may or may not be the right measure to look at for a hospital for your particular product. Another one is the status of the hospital with respect to their business model. So are they a profit organization or a nonprofit organization? It's clearly going to influence the way their values, their purchasing, the way they make decisions, what their business model is. How about if they're a teaching institution or not? A teaching institution might have a core value of having as many different technologies available as possible so the students and residents are exposed to as many different techniques and methodologies versus a very similar sized institution that values standardization. So there may be particularities of a teaching institution that are different from others. And then what about their Medicare status? Are they participating in facility, non-PAR, opt-out? What is the mix of payers in the facility? Again, going to influence the way that they make decisions and what they value. Is it a system versus a standalone institution? We see a lot of consolidation here in our local market. Standardization is often one of the major drivers that comes out of when you're developing a system of hospitals that could have big implications on the ability to place a new product into an environment that's very standardized, or it could have a very big upside of, well, if they use it in one institution, they're going to use it across the entire institution. So again, a really important factor to consider. Another is what specialties are offered. So think about perhaps a pediatric hospital. A pediatric hospital may have a much lower tolerance for anything hazardous in the environment. They may have certain criteria for environmental conditions that even another hospital of a similar size with a different patient pool might not have that same high sensitivity to those environmental type factors. Another factor could be the patient demographics. Again, think about the difference between the ER in an inner city hospital versus the ER in a rural hospital. The type of trauma, the types of cases, the types of injuries that might come in those two facilities may be very different, and that would drive the needs of that OR and of the people that work within that OR. And then there's the geographic location. Again, beyond just the patient demographics, if you think about the business of a hospital or and the need to attract patients, if you look at a market like New York City, where there are well over 60 hospitals in the Big Apple alone, and the state of Wyoming that has less than 30, there's going to be a quite different level of competition between those two in those environments. And so that's going to also drive business decisions that the hospital makes. And last but certainly not least, the institutional culture. Here's one that's kind of a wild card. It could be a lot of different things. A church institution might have a particular mission to service a particular population. An institution might have the desire to be cutting edge. There may be a lot of other institutional culture factors that drive into the decision making of the institution. So this is a really broad picture of things. Certainly there are more criteria. There may be criteria that are very specific to a specific product area or a particular technology. But this is just to make the point that a hospital is not a hospital is not a hospital. They're not a uniform thing. Even though it's a B2B sale, it's a B to many different kinds of B. One thing about the hospital market, like every other market, it has its own language. So I'll make a little sidetrack here to talk about acronyms. There are lots and lots of them. If any one of the speakers gives you an acronym and they don't define it, they're not supposed to do that, but if they do, at the question period, please ask, because you're probably not alone. I probably need to know what it is too. Here's some big ones that you'll see and hear throughout this session and the next one in Columbus. A GPO, a group purchasing organization. These are buying groups that are essentially the participating hospitals have a contract with pre-negotiated pricing. Some of the big ones are Premier, MedAssets, Novation. There are national ones, there are regional ones, there are ones that are specialized in different areas, and I'll talk about these a little bit more towards the end of the presentation. There's HCAHPS scores. These are patient satisfaction scores. These are another acronym you'll hear from the hospital. They care about their HCAHPS scores because it's nationally publicly reported information. An IDN, an integrated delivery network. These are networks of physicians and providers that, and also payers together in a group in a regional area. Probably one of the biggest is Kaiser Permanente, but there are some in Ohio as well. ProMedica, Ohio Health, there's some local examples. And then there's the VAC or VAT committees, value assessment committees. I'll leave that one till a little bit later because we're going to talk about that later on here and in other sessions. That's a pretty important part of, it's a pretty important acronym for anyone selling to a hospital to know. All right, so we talked about the hospitals as a landscape of different kinds of institutions, but now let's kind of go inside the hospital and look at the hospital on the inside. And the inside is as diverse, if not more diverse, than the kinds of hospitals there are on the outside. There's essentially 5 major functions in a hospital. All the sub-functions will vary from institution to institution, but there's an administrative portion, an information services part, a therapeutic services part, a diagnostic services part, and a support services part. When it comes to the administration, this is the business end of the organization. These are the people that own and manage and run the hospital. These are certainly the high-level decision makers. You're not going to see them involved in every single minute decision or purchase. However, they will set the tone for the organization. They'll set the organization's goals and values, and so their influence will be felt throughout the organization. They will be involved in large purchases. I can't imagine that the CFO does not see the purchase order for a new MRI or something that's a multi-million-dollar purchase. I would imagine that's going to go right through the C-suite. However, you know, the day-to-day purchases, they are certainly not involved in. Next is the information services. Hospitals are huge data generators. There is patient information, there's financial information, there's employee information. And then, so there are the people that are for admissions, for coding and building, medical records, computer information, health education, human resources. All of those departments are responsible for processing, managing, and maintaining the infrastructure of the hospital from an information perspective. Data integrity and security, these are all major issues for this group, and they manage a huge amount of information. The next group is the therapeutic services group. Again, a very diverse group, and it will depend on the type of institution, but it includes things like surgery, nursing, pharmacy, all the different types of therapies, whether it's mental health or physical, occupational, lots of different disciplines that are all focused on providing care and treatment to the patient. Now, any one of these categories could be broken down a lot further. If you look at surgery, for example, a large hospital would have multiple surgical disciplines. There'd be general surgery and vascular surgery and orthopedic surgery, a brain surgeon, all different kinds of surgery. There would be all of their teams, so the nursing teams that are specialized to those surgeons, the support people like a radiologist or an anesthesiologist that is also part of that team, and then the management of the OR managers and other people who are responsible for maintaining the actual work, the workflow and the processes and the purchases for the therapeutic services. So it's a really broad range of people that could be involved in just one of the many categories of therapeutic services. Similarly with diagnostic services, a wide range of individuals, the lab, radiology, nuclear medicine, emergency medicine. This is the group that's responsible for diagnosing illness or injury, finding the sources of illness or injury. Again, this group could break down into a lot of different categories. If you took just the laboratory, number 1 on the list, a large hospital might have a clinical chemistry lab, a pathology lab, a molecular lab, a microbiology lab. The labs are going to have lab managers and supervisors and bench technicians and people that do coding and people that maybe even receive samples in and out of the lab. So there could be a very broad range of people beyond just clinicians that are part of this group. The diagnostic services also produces a lot of information. They produce all of the test results and the information that is given then to the therapeutic teams to make decisions about care. So a very major function, and in every institution there is some function of each of these areas. And last but certainly not least, the unsung heroes probably of the hospital, the central supply, the support services including central supply and purchasing, the biomedical teams who repair the equipment and keep the infrastructure of the hospital running, the people that clean the hospital, that give you something to eat when you stay there, that actually keep the lights on by replacing the light bulbs that burned out. There's a lot of people and a lot of different services in here that apply to many different kinds of products that are used in the hospital. So that was my real quick tour, a fairly quick tour, of the organization of a hospital. And my point was not to be exhaustive in every kind of possible way about what's in the hospital environment, but really to give a picture of the diversity within the organization. And Within a hospital, there's a number of different groups, and when you think about selling to a hospital, you need to think about how your product might affect many different people in these various categories. For example, perhaps you are looking at purchasing a mobile C-arm for mobile imaging equipment for the OR. So there's the surgeons and the surgical team that would use that, certainly would evaluate the product. There would be diagnostic people because there'd be radiologists and other people that would be supporting that equipment. There might be biomedical people that have to be involved in that sale because they need to understand the implications of maintaining that instrument. There would certainly be information services people because they have to have that instrument talk to their hospital information system. And then if it's a big enough purchase, certainly the administration would be involved in that as well. So you can see how any product would probably touch most of the departments within the hospital, or most of these organizations in the hospital, and a lot of different kinds of people. So who's involved in the hospital sale? I've kind of touched on this a little bit. You have to think about them in terms of who is going to be using the product. So it could be clinical staff or support staff. In the case of, say, an infection control product that is a cleaning product, it would be the support staff that are housekeeping that are actually using the product. It could be a product that's actually used by patients. And then there's all the people that will influence that decision. So the people that will give input into it. Is it the right product for us? Is it within our budget? That could be clinical input. It could be input from support staff. And then the person who's actually going to make the decision. That could be a department manager, or it could be a committee, which brings us back to what I promised I would talk about at the beginning. I said I'd come back to this, is a value analysis committee. What are they? They have a number of different names: value analysis committees, value analysis teams, new product committees. I've heard them not so affectionately referred to as sales prevention committees by people that actually sell to hospitals. But really what their role is to assess the value of the product to the organization. And so their job is to understand the clinical benefits, the financial implications, and how that product's going to fit within their institution. And we'll have a chance to talk about those a little bit further later on. Okay, so back to our initial "it depends on" question. The buying process is going to depend on what your product is and who are the stakeholders. The advice is please map the buying process for your product. And how do we go about doing that? There's essentially 3 components to it. The first is really understanding the customer. Why do they need it? When are they going to do something? Why would they be motivated? Why this particular product? Understanding what the customer's motivations are. The second part is understanding what the organization's policies and procedures are. We're going to talk about that a little bit more in the fireside chat coming up, but essentially that's a really important part of mapping out how your product is purchased in the organization. And the last part is why I talked to you about so many different people inside the hospital organization, is really understanding who are all of the decision makers, the influencers, the users, the stakeholders that are involved in that process. So I can kind of wrap up that part of my talk to you by saying, it depends on a lot of different things. It's going to depend on the type of institution, the types of things the institution values. It's going to depend on the different users that are going to touch the product. It's going to depend on the attitudes of the people and of the various departments and how many different people that product is going to touch. So there's going to be a really broad range of things it depends on when it comes to selling into a hospital. The last part I'd like to cover before I move on to the next part of our program is the trends that are affecting hospitals. This is not an exhaustive list. There are many, many of them. If you just Google trends in healthcare, you'll get lots of opinions about what the key trends are in healthcare. But here's some of the ones that I heard from people as I talked to them, of things that they felt were affecting them today. The first one being the increasing utilization of GPOs. I mentioned GPOs at the beginning, group purchasing organizations. It's estimated now that 98% of hospitals participate in at least one GPO, and some have several. And about 70% of hospital purchases are made through GPOs. This is not a new trend, it's a trend that's continuing, and we expect it to continue, and the GPOs want it to continue because they continue to offer more and more services to hospitals as part of when they are part of their group purchasing organization. Services that help them streamline inventory, to control costs. You know, they've really focused on helping the hospitals be more efficient from an operational and purchasing perspective. This can be a good thing, it can be a bad thing, and it's certainly a thing we need to consider, a trend that we need to consider when we talk about selling to a hospital. The second is the increasing utilization, or hospitals are increasingly establishing clinically integrated networks. Clinically integrated networks are networks where there are groups of providers. This has implications for standardization, driving standardization. It's a trend that we expect to see continue. The Affordable Care Act can't have anything to do with hospitals or healthcare without mentioning the Affordable Care Act. It's driving hospitals to care more about the care, about measuring the effectiveness of their care. It also has implications for companies that are selling to physicians from legal, medical legal perspective as well. And we have Mark McAndrew here later who's going to talk about that in his presentation. The HCAHPS scores that I mentioned before, this is driving behavior to actually care about what the patient says. These are nationally reported, publicly reported scores of patient satisfaction based on a standardized survey that's conducted. The data is available on the Hospital Compare website, so hospitals can see how they rate compared to other hospitals. And certainly if you're trying to compete in a local market and you want to make sure that you have the best scores compared to the hospital Y next door, you can bet that the Cleveland Clinic and University hospitals are comparing their scores regularly. The growth of accountable care organizations. And this is all part of the trend towards having a value-based care versus a fee-based care. You know, this is a trend that we're seeing that is the total care of a person within their system, within their geographic area. It's not just they came in, they had a procedure, they went home, I got billed for that procedure. If that person comes back again, that's part of the same value, that's part of the same incident, and so that's really driving the way hospitals look at the way they're delivering care. So I've mentioned a few data sources in this. I thought I would include those at the end of this presentation. The first ones are all free data sources that you can access. The American Hospital Association Medicare site has actually a lot of data about hospitals if you want to dig into their data files. The Ohio Department of Health, the Ohio Hospital Association, lots of different sources. There are also a lot of market research companies in this space. So there are market research reports available for a fee from a number of different organizations. There are many very good ones. I mentioned Google earlier. There is a lot of information that can be available through trade publications. There's a supply chain, hospital supply chain purchasing associations. There are hospital administration associations. Those associations all produce really good journals that can help you understand the trends and the things that are affecting hospitals right now.